Sarah Moore with Delta Zeta is on the phone.
Hi, Sarah. And
Hi.
Delta Zeta is where?
From McIntosh, Alabama.
Oh, McIntosh has been supporting us. Thank you so much. McIntosh is going to get the group award for having the, y'all are going to get the award for having the most people in.
Oh, really? Okay.
Yeah. All right. We see that now.
All right. All right. Thank you.
All right. It is 7 o'clock. Welcome, welcome, welcome. It's time for us to play a little COVID Jeopardy. Thank you for joining us tonight. It's an Orville thing. And so we have the mayor of Orville here, so we know we can get started. Mayor, do you have any team members here to help you? But you've been swinging heavy by yourself.
Dr. Hendry, good evening. Good evening. Yes, ma'am. We do have some more people that's going. Yes, ma'am.
All right. Well, they're coming in. They're coming in. So we look forward to that.
Hello.
Hi, we got Judge Petway on. Hi, Sarah Shelley.
Wonderful.
All right.
Hello.
It's time to get started.
Marilyn. Wonderful.
Hello.
Okay.
All right, ladies.
All right.
And gentlemen, it is session number 3 of our 4-session series, where we hope at the end of our engagement tonight, you are empowered with knowledge. We say limited skills, except for Zoom skills maybe, but you will walk away with nuggets of wisdom that you will have garnered from not just playing our COVID Jeopardy, but also nuggets from our expert tonight. Our medical expert tonight. So Dr. Ford, can you introduce our expert tonight? If you unmute.
Yes, ma'am. Good evening, everyone. How is everyone doing? Let me get it pulled up here. Dr. Bailey has been a longstanding family physician in the Selma region, initially in private practice in Marion. He joined UAB Selma Family Practice, where he spent most of his professional career. In the UAB system, he balanced clinical practice, both in the hospital and the outpatient clinic, with the academic development of young physicians in training for Family Medicine Board certification. Until 2015, he was the chair of the Infection Control Committee at Vaughan Regional for over 30 years, a role that dealt with emerging infections of all types. Dr. Bailey achieved Professor Emeritus status with UAB and continues part-time to assist the program with various elements of residency training and clinical care. In addition to this, he has become a Southeastern regional consultant for hospitals that are becoming institutions, leading the development of new residency training programs in family medicine and in internal medicine. Dr. Bailey is pleased to be a health equity ambassador leader, a healer, and tonight's guest speaker. He is excited to field questions and provide education regarding COVID prevention and measures available to promote health and well-being during this pandemic with COVID-19. Welcome, Dr. Boyd Bailey.
Thank you for joining us, Dr. Bailey. We are so excited that you are here. And so for those who are attending for the first time, our rules of engagement will be like this. Ms. Bailey, will you pull up our Jeopardy board? We have a board and she's going to share the Jeopardy board. Now, if you have watched Jeopardy, remember the answer to the question is always what? A question. So you get your points by getting the right answers. Now, Dr. Ford, you've been keeping up with our leaderboard. All right, do you have Do you need to share your screen to tell us the scores? Or can you read them to us? Unmute yourself.
I can do both, but I can do it quicker just reading off the top.
And then we'll share it. Okay. Give us the top 5.
All right. So we have Dr. Crenshaw with the top as a top score with 1,500 points. Coming in second, Mrs. Lavinia Lumpkin with 1,200 points.
Oh, the mayor.
The mayor, yes. The third place, we have in third place, Mrs. Stephanie Brand with 950 points. Fourth place, we have Ms. Wanda with 200 points. And then we have 3 that are tied for the 5th place. Ms. Shaniqua has 100 points. Mrs. Celeste Petway has 100 points. And the student that was at the Selmer Student Center has 100 points.
All right. All right. So fret not. You can take over these points just by selecting the right points at, you see where the points are? And masked and vaxxed will be our double Jeopardy point questions. So if you pick anything out of masked and vaxxed, it will double those points. Now, are there any questions? Now, I know that the Macintosh Zetas have a team. They have at least 3 people on. And so when one of the Macintosh calls for the question, we're going to allow any of the 3 of you to collect that Macintosh team. Mayor Lumpkin, do you have a team yet? I see you rattling.
Yes. I have a team.
All right. So look out for the Orville team. Mayor Lumpkin been holding it down by herself, but she has pulled in some team now. So Mayor Lumpkin, when you call the question, any of your team members can chime in to help you answer in case you need some help.
Okay.
All right. Do we have another team? All right. The rest of them are hanging solo. All right. But what we're going to do, if you don't know the answer, don't sweat it. Anybody that knows the answer can chime in, but they take your points if they do that. But we're so kind, we're going to give you half credit just for stepping up and asking for the question, okay? Because in this Jeopardy, everybody gets a prize somehow. All right. So, who will be bold enough? Let me let some of these folks in because the mayor has called her team together. And I want to make sure we let them in. All right. Now, do I have a hand? If you open your, or raise your hand or open your video so we know you're talking to us, we can recognize you. All right. Oh, Judge Petway stepping out the gate. Come on, Judge. What you want, Judge?
Give it a shot for 5. Ooh.
All right, say that again.
Give it a shot.
For 500.
Give it a shot for 500.
Besides getting sick with the virus, the fastest way to herd immunity is for people to do this.
Get immunized.
Yes, what is
Remember,
get
we playing Jeopardy now. Remember the little hint. She gets the credit.
Oh, what is to get, thank you, to get vaccinated?
All right. Our expert, what nugget would you like to drop?
Well, it's very, very important, and I agree. That's the way to whip these viruses like this is to get to herd immunity, and the vaccine is really ramps people's immunity up, and that's what we want. We don't want people getting sick. We want them to be vaccinated, and if they do get sick, it's only a mild case, and keep on. That's what I have to say about that.
Great. Thank you. Does anyone have a pressing question for our expert regarding that? All right, all right. They're still coming in. I'm letting them in case they was somebody's team. Okay, who's going next?
I was sitting here, got loose again.
All right, who's going next?
Dr. Hendrick, let me give it a shot for $400.
All right, come on, Mayor.
The CDC recommends that ages 5 and older should do this to help prevent the spread of COVID-19.
What is get vaccinated?
Correct. What is get vaccinated?
Oh, look out now. She's on the roll. Okay, all right.
Very good. Yeah. And again, you know, and specifically that now is the Pfizer vaccine, not the others for the 5 and up. It's been cleared. And you know, I'll say, you know, one thing to point out about this, you ask the pediatricians, if they have children 5 and up, are they having their children vaccinated? And they says, yep. So it's you know, it's looking good. So I think you know, if you have children, be thinking about it and go for it.
5 and older, 5 and older. All right. Who's next? Do we have a hand? I've got Zeta members helping me watch the screen. So Wanda Walker is ready, she says. Come on, Wanda.
Give it a shot for 300.
COVID-19 severity of illness is reduced if you do this before exposure and onset of illness.
What is get immunized? Get a shot.
Vaccinated, and she
Yes,
did it in question 4.
I mean,
Says
I've been
she
practicing.
been practicing all week.
Thank you.
You know, I'll say this on the point, a good point on this is it's been clearly all along as this vaccine was developed and the testing was done before it was released. It was clear that what it was doing was reducing the severity of illness. And it really never was thought to be something that was going to just stop people from getting getting sick with the virus. And I never thought that as I was watching how it was being developed. But that was very, very important, is getting the severity of illness, reduce the number of hospitalizations and how sick you are if you were in the hospital. Those turned out to be extremely important parts to the vaccinations.
All right, next question. Let's see, Wanda, you want another one or you got to take your hand out? All right, we're looking for someone to open up. Just unmute. All right. Evelyn Hudson. Evelyn Hudson, grab it first. I'll come back to you, Julia. Hold on.
Okay.
Evelyn Hudson, what's your category and your amount?
I don't feel well for $300.
All right, 300.
Testing positive for COVID-19 requires doing this and staying away from work and public places for at least 5 days to prevent the spread of infection.
What is a quarantine?
That is correct.
Yeah, that's important. Basically, to give the virus time to clear from your system and be less that you're spreading, and that the 5 day, looking pretty good. So better than the 14 days that I think when it started.
Mm-hmm.
All right. Does anyone have a question for our expert before we ask Julia for her amount, her category and her amount? All right, Miss Julia, open up and tell us what you want.
Let me get max or vex for 500.
Okay, remember that's a bonus, double jeopardy. Go for it.
This one is the twist that Dr. Hendricks referred to. The potential to be the equalizer of health disparities, especially around infectious diseases. I could never sleep at night if I developed anything, if any product of my science came out and it did not equally benefit the people that look like me, period.
Do you have any idea what the question is? Miss Julia, are you a part of any group, Miss Julia? We'll get your group to help you.
Hold on, because I'm driving at the side trying to read this question.
Okay, well, let's read it. Okay.
I'll read it again. Vaccines have the potential to be the equalizer of health disparities, especially around infectious diseases. I could never sleep at night if I developed anything, if any product of my science came out and it did not equally benefit the people that look like me, period.
And I think the question is, who said that?
That's
Okay,
correct.
but she's driving and she can't see. Julia, are you what group are you connected with? Are you can you tell us?
Since she's driving, do you want me
driving,
to?
she may have dropped. Okay,
So-
but, all right, let's see if anybody wants to swoop up that 1,000 points. Who remembers, especially if you were on last week?
I'll take it.
We're not
I'll
gonna
take
take-
it.
Okay,
Oh,
Stephanie.
Mayor Lumpkin wants it.
Wait.
Oh.
Okay, Mayor Lumpkin got it. Mayor Lumpkin
No,
got it.
ma'am. I can't remember her name, but I know she was part of it when the first came out with the vaccination, the medical part of it. I can't remember her name.
Okay, all right,
take
let's see. Jocelyn.
Okay, I'm like the mayor. I can't remember her name. I just know she's one of the developers of the vaccine.
All right. Who else said they'll take it?
I'll take it.
All right, Stephanie. Come on, Stephanie.
Dr. Kim Corbett.
Yes, sir.
All right.
Gosh.
Corbett, yes.
Stephanie scooped up that 1,000 points.
Kizzy Corbett, Kizzy Corbett.
Kizzy.
Smart woman.
Absolutely, yeah. Dr. Harvard, and she was the first African-American woman scientist to be involved with the development and deployment of the messenger RNA vaccine of Moderna. So very, very key part that she played.
All right. Thank you. Let's see, for those bold souls, please at least give them 100 points for stepping out there.
That's right, doctor. That's right.
Okay, who's next? Who's brave soul? Get a category. All right, Wanda's ready to step out there again. Come on, Wanda.
Yeah, because I'm gonna give it a shot for 200 so I can get through with this category.
COVID-19 transmission can be significantly reduced by doing this.
Only thing I can think of is okay, let me see. I gotta move this. Repeat that. I
Okay.
got it. COVID-19 transmission. Oh, can be.
COVID-19 transmission
Okay,
by doing this.
by getting vaccinated. What is getting vaccinated?
Yeah. Okay.
You're sneezing on people you don't like, but I could have been wrong on that. Okay.
All right. Doc, what's your nugget for us?
Yeah, and again, this goes back to something we talked about earlier. It does reduce the transmission. It doesn't stop it, but it reduces the transmission, which is good. Plus, again, as we said earlier, it reduces the severity. So two different things. The transmission and severity are two different things. And so it does, again, a good point about being vaccinated.
All right. I saw Judge Petway's hand. What's your category and amount, Judge?
I don't feel well.
I don't feel well for 500. She going for the gusto.
Common symptoms of COVID-19.
What are flu-like symptoms? Cold symptoms or fever, raspy throat, lethargic. Am I close?
Correct, yes.
Yeah, you did good.
That was very good. There are several. 1R, headache, fever, cough with or without chest congestion, shortness of breath and or difficulty breathing, a sore throat, runny nose, loss of smell, loss of taste, muscle aches, fatigue, nausea. It can be one, it can be any combination, it could be none of these.
All right, I'm expert. What do you have to drop on us?
Yeah, let me point out something, and just as a little bit of a history. As you know, there's been variations of this have come through. They've evolved and changed, and you've heard them called by different names, like Alpha. One of the early ones was Alpha, of course, and then more recently, this past year and going into the fall, was Delta, and then of course the Omicron. The earlier versions of these had a lot of loss of smell and loss of taste. Omicron has not been quite as much of that. So it's been more of the upper airway head cold type symptoms with it, which was maybe part of why it seemed to be a little less severe. It didn't get into the chest as bad as earlier version. So so that part was good. So you can't go by loss of smell or loss of taste now with the Omicron so much like you used to could. That was almost diagnostic of the earlier
Of the
variants.
Yeah.
Unless there's any questions about this.
So
But you can still have this.
Dr. Boyd, many of the people are still wanting to check for temperature. What's your thoughts on whether or not taking just the temperature is a good assessment now?
The problem is, and I think even early on, it was not that good of a screening test. It's not that good right now in terms of in other words, you have false negatives. If you don't have fever, it does not mean you're not contagious. So that's the problem. If you do have fever and you're being screened, then your chances of having COVID during this pandemic, where it's one of the main infections out there, goes up a lot. So no fever doesn't tell you much, but fever does mean something.
Okay. Any other questions about that?
Yes.
Okay, go ahead.
Because it's allergy season, runny nose and all of this, is there a way to kind of figure out if you have COVID or not, since some of the symptoms are the same?
Yeah, I mean, then that's a problem, because I have to try to sort that out if I'm talking to someone who's got some kind of symptoms. If I have tended the last couple of months to, if someone calls up and say, I think it's my allergies, and I just got a runny nose and this, and that possible and available, I still have them try to go and get a COVID screening test. But if I'm really, and as you know, many of you know, the testing has been kind of scarce at times and difficult for the patients to go and actually get. So I try to sort through it. If they have very, very clear just allergy type symptoms, and there's no sore throat, no headache, nobody aches, and it just fits exactly what they have had this time of the year in times past, then I may tell them, okay, let's watch this just a little bit. Don't rush out and get tested. Keep me posted. Let's see what it's sounding like tomorrow and make another decision. So that's kind of how I look at that.
Thank you.
Okay, any other questions? Great questions, great questions.
I want to speak to that for a minute. I had a positive test, although I'm triple vaxxed and everything, in the second week of January. And I had a lot of symptoms, coughing and fatigue and all that kind. I could tell I was sick. And I went down and got a test and I was positive, blah, blah, blah. Well, about a month later, I'm still having a cough and some of that kind of stuff. And so I had, by that point in time, ordered my 4 free tests from the US government, and they had come in. So I did the 2 tests. The way they work, you do it twice. You do it once, you do it 24 hours later. And both of those were negative. So even though I was still having a persistent cough, I was no longer COVID positive. And that was a big deal to me because I had wanted to go into work and I didn't want to expose anybody. So I put the website in the chat. So that's, everybody should have their free at-home test. It was real easy. It took about 10 minutes to do it. And I had some peace of mind. So that's an easy way to get a test today, because it took about 2 weeks for us to get once we ordered it before it came to the
Karen,
house.
can you switch and show that slide with the information on it? Are you able to do that?
Can you see that?
Stop share and then reshare.
May I ask a question while she does that?
Sure.
The home test kits that we did receive, can you use them on children under 5?
I do not know. Now, the chances are, I would say it would be effective. If you can get the swab in deep and collect it well, I don't see why under 5 why it wouldn't work. So yeah, I would think probably yes.
So
Well,
we put the information on the screen for you. If you haven't gotten yours.
We ordered ours and, they sent us 4. And if you have to use 2, how many free kits can you get? How many? I know it said 1 per household, but if you used them up, can you order more?
The way it seems to be working is if you have so if you have 2 adults in the house, as long as you enter 2 separate names and give 2 different email accounts, they seem to be sending 4 kits per adult member of the house with a different email. So I don't know if they intended for that to occur, but it seems to work. It does take a while to get the kits. Some people get them as quickly as 2 weeks. Other people are getting them in 4 to 6 weeks. If you need to be tested sooner, I know the Dallas County Health Department is doing testing Monday through Friday. You can also get testing through some of the CVS, Walgreens stores. You can also schedule your COVID vaccinations if you need to get vaccinated, or if you need to complete your vaccination series, or if you just want to get the booster and boost your immunity because it's been a while since you received your last dose. So those are available also through the health department, CVS, Walgreens, Walmart. There are many ways you can do that. But I would go to the COVID-test.gov website and go ahead.
Karen, it says 2
and order
two and
for,
above.
if you have an adult family member in the house, order for them. Okay, good, because I was just
for ages 2 and above, and it says for ages 2 through 14, an adult should collect the swab.
Oh,
Yeah,
okay.
absolutely, because children cannot accurately, and many adults cannot accurately swab for themselves. So yeah, and they can be dangerous if you go too deep. So be careful with that.
Okay, I didn't realize that. Okay, thank you. That's good because my grandson, he's only 2, first time allergies. So it's like I've been taking his temperature. And now that you guys said that the temperature really isn't an accurate milestone, I was just kind of concerned because of this sneezing and his runny nose and his voice is gone, that kind of thing. But he's been screaming a lot too because we've had a life change. But I was just kind of wondering. Thank you.
Yeah, so definitely, and if he starts running a fever greater than 100.4, 101, go ahead and take him to the pediatrician.
Okay, all right, great consultation for you today, Wanda. All right, let's get back to some Jeopardy. All right, who's going next?
I'll go.
All right, I heard I'll go. Uh-oh, look out, it's Stephanie. All right, come on, Stephanie.
Let's take away 100 for give it a shot.
All righty.
Influenza transmission can be significantly reduced by doing this.
What is vaccinated?
Yes, what is vaccination?
All right. Doc, what you got to say?
Yeah, let me take this opportunity to say something about the flu shot, because I've dealt with this for 30, 40 years. And so I can't say enough of the flu shot. And I've had to deal with this a lot, with people come in and saying that, oh, I took the flu shot, I don't take the flu shot because I took the flu shot back, sometime or another. And then I came down with a bad case of flu. And here's let me just take a minute, because I want to talk about this just a little. Is the flu shot is one of the safest things that we ever ask someone to do. About 20 years ago, a big university study was done because enough people would come and say, that they took the flu shot and they thought they got sick. Well, theoretically, there is nothing about the way the flu shot is put together and what's in it. There's nothing live. There's not a live vaccine in it. There's nothing that you can catch by taking the flu shot. So in theory, people should not get sick. And so this big study was done in which, the people all knew that they were in a study, and this was done and handled properly. It was this double-blinded type stuff that's done. And everybody fully informed about it. And one group got a shot of sterile water, and the other group got a shot of the flu vaccine. And then the doctors that were running the test study looked at and analyzed the symptoms people had every day for a week, and then every week for a month or two, and every month for a couple of 3 months. And then when they got through, then they opened the study up to see who was having what kind of symptoms from the flu shot. And there was no difference in the shot of sterile water and the flu shot, except for at about day 3, people that got the flu shot had slightly more soreness in their arm at the location of the shot. And it kind of showed that it was as the theory was. So for anybody that is hesitant about doing the flu shot, remember this point, that it's basically as safe as taking a shot of water. That has to do with the flu shot. But
if I can add to the reason, I know that the topic is COVID-19, but the reason this question is here is because it is flu season in the midst of coronavirus season. And we are seeing individuals that are unfortunately becoming ill with both viruses. So you may have heard people talk about Flurona, and it's an influenza virus coupled with coronavirus infection simultaneously. So if you've not been, we want to encourage you to do that as well.
All righty, Shaquita, I'm sorry, I'm mispronouncing it, has her hand up. I'm not sure if it's for a question or a category.
I guess I'll go next.
All right, come on.
I don't feel well for 400.
All right.
We all need healthy lungs to breathe. COVID-19 in the lungs makes it difficult to get enough body.
It makes it difficult to get enough of this gas. I'm sorry, the internet's going in and out, so.
So what's your question for that answer?
I didn't hear her. I'm reading it now. I didn't hear what
Okay.
you said.
All right.
Okay. We all need healthy lungs to breathe. COVID-19
Your internet is
in the
going out,
lungs
Karen.
makes it difficult to get enough of this gas in your, can you hear me now?
It's going in and out. Do you have it, Shaquita? Shaniqua? Shaniqua?
Can you read it for Dr. Hendricks?
We all need healthy lungs to breathe. COVID-19 in the lungs makes it difficult to get enough of this gas in your body.
What is oxygen?
Yeah.
All right, are you part of, yay, are you part of a team?
Dr.
Yo, I don't know
Ford
if you-
invited me. I don't know if it's a team or not.
Okay, and where are you calling from?
Marion, Alabama.
Okay, all right, great. All right, our expert has some nuggets for you.
Okay.
A good guess on the gas. Yeah, oxygen is a key ingredient of the air that we breathe, and so you can't say much more about that. But unfortunately, COVID it attacks the lungs, and that's been one of the big problems with managing COVID-19 cases. Can't say much else about it.
Are there any other questions for Dr. Bailey? All right, Shaniqua, do you want another question, or your hand is just still up?
I'm gonna wait for now. I'm gonna let somebody else go.
Oh, okay. Hudson, come on, Hudson.
I don't feel well for 200.
All right.
My daughter complained of runny nose and extreme nausea before bed last night. This morning, she is running a fever.
What is COVID?
Yes, what are COVID-19 symptoms?
What are the symptoms? All right, Dr. Bailey.
Yeah, again, just having just a couple of the symptoms, your suspicion has to be pretty high. So that's good enough to say better be thinking about getting tested.
Okay, let's see whose hand went up first. Was it Wanda Walker? You ready to come back?
I am. I'm feeling strong and confident. So, Mayor, I'm going to try your strategy and go for it. Because all I can see is that's a fact, Jack. But you're welcome to help me out now, and we'll split the prize money, okay?
500. Okay.
Antibiotics are effective in the treatment of bacterial infections, but not these types of infections.
What is COVID infection?
All right,
I
somebody
heard somebody
want to
say,
help me? Scoop it up. Who's going to scoop it up?
Come on here, Mayor.
I remember that from last week.
Come on, Evelyn.
What about a viral infection?
Yes,
All right.
viral infections.
Hudson, scoop that one up. Y'all better watch her. She creeping up on you.
She showing up here.
Okay, we got time for maybe two more questions. Oh, Doc, you got something else to
let me, yeah, let me see. Can you hear me okay? Am I breaking up any?
He's breaking up, but you're coming through pretty much, but you are breaking up.
Okay, well, let me just say this. Hopefully it all comes through, but bacteria versus viruses. Bacteria are cells that pretty well stand alone. They are a live cell that they don't need other cells to kind of stay going. But a virus is only kind of a part of a cell. It has to attack living cells and get inside the cell and kind of hijack the system inside a cell in order for it to reproduce. So bacteria respond to antibiotics. Now, there are antiviral agents that work you could call them antibiotics for viruses, but generally not near as antibiotics are for bacteria, and very limited agents are out there for viruses, antiviral agents.
To that point, real fast, if you test positive for coronavirus, it is a good idea to ask your doctor if you're a candidate for an antiviral treatment, because there are limited supplies, but there are some antiviral treatments that can be administered at a local hospital in most cases as an outpatient under certain conditions. So make sure you ask about that. It's very important.
Yeah, and let me add more to that just a bit. What has really been highly effective has been the monoclonal antibodies. Now that's been a treatment, and that's not exactly an antibiotic. That's just using an antibody. It's not the same as an antibiotic, but an antibody that will go into the body and wrap those viruses up and neutralize them and shut them down. And the monoclonal antibodies infusions have been incredible up until the Omicron. Then the ones that we had became ineffective, or the Omicron outsmarted the monoclonal antibodies, and then the new monoclonal antibodies that have come along, they are very limited in supply. But if you are very sick, you ask your doctor about getting the monoclonal antibody, and it's very important to try to get that in the 10-day window from the time you get sick, from the time your symptoms start in that 10 days, because as you get further into that 10 days and out of that 10 days, the monoclonal antibodies do not work either. They don't work as well as you get toward, they just get to where they don't work at all. So anyway, keep that in mind and take the option if you need to.
Mild illness, a tincture of time, but if it's moderate illness, or just ask your doctor, because it may be that's what you need.
And let me say one other thing on that. As far as an antiviral agent, there's one you'll hear about. It's called Paxlovid, and it's a pill, and you get a prescription, and you go to the drugstore, I believe, and that's where you get it, and you can take it. But it's also in short supply, and it has a lot of side effect problems, interaction with other medications that, to me, that limits its use a great deal. So anyway, just have to talk to your doctor about all your options.
Wow, so you do need to consult. All right, we have time for one more question for tonight.
Okay, I tell you that's a fact, Jack.
All right, Julia, come on in here. That's a fact, Jack. 400.
The COVID-19 virus can grow or live in your body
for this
long.
What is 14 days?
Let's see the answer.
Yeah.
Let me see.
Good.
You got it. Yeah. All right. Now we're gonna wrap it up for tonight, and we'll will stop share. And we will ask our leaderboard, Dr. Ford, are you ready to give us some points tonight? And remember, your points are cumulative. So we have one more Thursday night. The person or team that comes out on top next Thursday will get a little piece of chump change. All right, plus all the other gifts. Now, while she's giving the leaderboard scores, Karen, if you can show the gifts again, and we'll be listening to Dr. Ford. Go ahead, Dr. Ford.
Okay, I was gonna share my screen. I don't know if you can share
Okay,
at the same
Karen,
time.
stop sharing so she can, yeah, she's ready tonight.
All right, here we go. Look on the board and see if you can find your name and share. All right, our lead score, Mayor Lumpkin with 2,100 points.
Yay!
And in second place, we have Miss Stephanie Brand with 2,050 points.
All
Dr.
right.
Crenshaw with 1,500 points. Mrs. Evelyn Hudson, 1,000 points. Ms. Wanda Walker, 700 points. Judge Petway, 600 points. Ms. Shaniqua, 500 points. And Ms. Julia, 500 points. And we still have, in last, the student from the Selma Center. Thank you all.
All right. Now we'll show the gifts. Everybody gets a gift. You get a gift. Some people are going to get more gifts than others because they've been on consecutively. And so, but you know, like Oprah says, and you get a gift, and you get a gift, and you get a gift. Well, thanks for coming. You all are going to get gifts. Karen, can we show them the gifts? Here you go, so you can see the gifts. All right. You're gonna get a vaccine card carrier, so you can keep your vaccine card clean. All right, you just slide it in there, and then on the back is clear. You're gonna get a KN95 mask and a mask extender. You know how your ears get worn from the loop around your ears? Well, with the soft going behind your head, you don't have to have it resting on your ears. And then you have a card case carrier to put on the back of your cell phone, because all of you are healers. You are now, because of your interaction with us, you are a health equity ambassador leader. Yay! So be sure to send us, Dr. Ford or myself, send us a way to mail to you. Those of you who are in Orville are going to go by the mayor's office so she can do the gift distribution there. Those of you down in McIntosh, we're going to send you a big set. So McIntosh will get extra gifts because they are the largest group in attendance. Yay. Now, are there any others from a particular group that we haven't recognized? We want to thank everyone for attending. All we need to know after next week, we hope our final gift will be in, and we'll start mailing out the gift packets. And you will get a packet with all of the gifts. Are there any questions? Thank you, Dr. Boyd Bailey, for those nuggets of wisdom. We heard some new stuff tonight. Every time we have an expert, we get a little bit more. And so we thank you. That's why different experts bring different nuggets. Thank you so much for sharing with us tonight. Are there other questions? As my granddaddy, the Baptist preacher, would say, are all hearts and minds clear? Make sure that we have a way of mailing your information to your packet of gifts to you. We're holding them out. We have one more gift that's due in. We hope we will have it next week. If it doesn't come in next week, then we'll have to do 2 mailings. but we will mail the gifts after next Thursday so you can get one of everything. We are so honored that you're here. We're gonna get everybody one of everything, but some people gonna get 2 or 3 to share with other people because they have earned extra gifts. Like Miss Darlene was the first one to sign in today. And so she gets extra gifts. All right, Miss Wanda, you've been here consecutively 3 weeks, so you're gonna get extra gifts too. All right. You'll have something to share with other people. Any other comments? Then we're gonna give you back what, 9 minutes of your time right now. But it's 7:49. Give you about 10 minutes back of your night, Mayor. All right, you kicking because it's all about Orville, right?
Congratulations, everybody. You're all healers. You're all healers.
Thank you, Mayor. Thank you, Mayor.
Thank you all. Beautiful
There's Miss Rhonda.
session.
There's that
Thank
super
you.
Rhonda girl. There's that super answerer. We heard you.
She
Well,
said she
thank
been practicing all week to make sure she said a question. We were not gonna catch her this week.
I really
Great
appreciated
job.
the message tonight. Thank you. Thank
Mayor,
you.
Mayor Lump, can you have any
Great.
final comments?
No, ma'am. I just want to say I have truly enjoyed the 3 sessions that I have attended. Can't wait for next Thursday.
Woo! All right, ladies and gentlemen, thank you for supporting Gamma Alpha Alpha Zeta in our effort to increase your awareness about COVID. Good night.
Yes.
Be safe.
Thank
Keep wearing your
you.
mask.
Good
Bye-bye.
night.
Good night.
Bye.
Bye-bye.